So today we shall discuss about two important cardiac emergencies. One is heart attack and other one is cardiac arrest. Another one is cardiac arrest. So many times we might have heard people dying because of heart attacks or cardiac arrest, and we may think that both of them are same. Okay, there is some problem with the heart in either of the cases, but both of them are not same. There is some difference. So let us try to understand what are heart attacks and what is cardiac arrest exactly. So coming to heart attack occurs due to the blockage of coronary artery. Coronary artery blockage. What is this coronary artery? If you see heart, on the top of the heart, there will be arteries which are called the coronary arteries. So these arteries will supply the oxygen and nutrients, okay, to the heart muscle so that the heart can beat properly and it can function efficiently. But if this particular artery is getting blocked by some way, then what will happen? Enough nutrients and oxygen will not reach the heart muscle. So heart, basically cannot function. And that is what is called as heart attack. Okay. So coronary artery blockage occurs due to high BP, high cholesterol, okay, diabetes condition, which is common nowadays. That's why we should have a check of all these problems more properly. Obesity is one more problem, lack of physical exercises, stress and family history. Okay, so we might have seen some people were doing some exercises and after the exercise they may die because of the heart attacks. That is extreme physical stress, when it is induced also, it can lead to heart attacks or cardiac arrest. Okay, so these are all the conditions which can lead to the coronary artery blockage. The coronary artery, normally the endothelial lining will be thin like this, but in case of any of these problems like high BP or high cholesterol, or in the case of obesity or diabetes, the walls get thickened like this, as you can see. So the blood flow will be restricted. So when a pipe becomes narrow like that, what will happen? Okay, the blood that is flowing through that will undergo a lot of pressure. So the pressure also will increase, the blood flow will get restricted, and sometimes clots may also develop like that, which will block the flow of the blood. And that can actually lead to non-pumping of the heart. That is, the heart may not receive enough oxygen and nutrients and it will stop altogether. That is called the heart attack condition. This is the first case. So heart attacks, when a person suddenly suffers with heart attack, he may be taken to the doctor, wherein some clot dissolving medicines can be given initially, like heparin, where they will clear that. They'll try to clear that. If at all it is not cleared, then they will go for either angioplasty or introduction of stents. A sort of wire system will be introduced which can clear the clot. Okay, so these are all the different techniques what the doctors can adapt to. Okay, then one more is cardiac arrest. So what is cardiac arrest? Cardiac arrest, how it is different is, here the main problem is the heart beating will stop altogether. Okay, so what is this beating of the heart, how it is generated? To understand that, we have a small electrical system within our heart. Our heart will start beating because of operation of an automatic electrical system. So there is an electrical system starting with SA node, it is called sinoatrial node, which will be present in the right atrium like this. From there, actually, the pace of the heart, the beat of the heart will start automatically. This is called the natural pacemaker. SA node is called the natural pacemaker. So automatically in the right atrium, okay, the sinoatrial node will trigger the beat of the heart. From there, it will be passed to another node called AV node, which will be present at the junction of the right auricle and ventricle. So from here, the impulse will be transmitted, the electrical impulse will be transmitted to what is called bundle of His. It is called bundle of His. From there, the impulse is getting transmitted to either of the ventricles through the Purkinje fibers, So if this entire electrical system is intact and it is operating, then your heart will function normally. But in the case of cardiac arrest, what is happening? There is a failure of the electrical system. The natural electrical system, there is some failure in that. So because of which, what will happen? Okay, cardiac arrest can happen. When cardiac arrest happens, brain and other vital organs, suddenly they stop receiving the blood and the person can die within minutes. Okay, the heart will not beat at all. Okay, and the person can die within minutes. Whereas in the case of heart attack, there is a chance for the person to survive. But in the case of cardiac arrest, okay, it is finally the death of the person. If it is a massive cardiac attack, okay, then the person will die immediately. The reason is brain and other important organs immediately will stop receiving the blood when the heart is not pumping. So it will lead to collapse of the person and death of the person. So, okay, so this is how there is difference between heart attack and cardiac arrest. Okay, so in the case of cardiac arrest, okay, basically they will do what is called the CPR. So many times we might have heard about the CPR, wherein they will try to activate the heart by pushing on the chest region. It is called cardiopulmonary resuscitation, it is called as. So if a trained person or someone can just okay, push the chest region to activate the heart, okay, and can try out this particular scenario, okay. And so because of this electrical system only, our heart is beating actually 70 to 80 times per minute. So if any problems occur in the electrical system, okay, it can lead to the tachycardia, bradycardia condition, high heartbeat, low heartbeat, or it can also lead to the condition of the cardiac arrest. So this is how these two are medical emergencies. Okay, and we should have some knowledge about what is a scenario which is causing these problems, okay, so that whenever we go to the doctor or any problem related to this, we can address it better. Okay, so hope you understood.